Here's a sobering fact. One out of every 8 men will be diagnosed with prostate cancer at some point in their lives. Annually, this insidious disease is responsible for the deaths of over 30,000 men right here in the United States. The most frightening aspect is its stealthy progression. It often develops without any pain, discomfort, or noticeable symptoms until it has reached a more advanced and dangerous stage. But this is the critical truth that too few people share. It is entirely possible to detect prostate cancer early. By understanding the key warning signs, you can potentially save your own life. According to the National Institutes of Health, prostate cancer isn't just the most prevalent cancer among men, it's also their second leading cause of cancer related death. The encouraging news is that you have the power to lower your risk and significantly improve your odds of survival by learning to recognize these early signals. In this video today, as a urologist with more than 2 decades of experience treating thousands of men across the country, I will be sharing 12 early signs of prostate cancer that are commonly missed. While they may appear insignificant, identifying them in a timely manner could be life saving. Please understand this isn't merely information, it's a vital tool to protect yourself and the people you care about. So, what exactly are these signs? Let's dive in and find out right now and find out. Here are 12 early signs of prostate cancer. Sign number 12 is blood in the urine. If you happen to look down one day and see that your urine has a pink, reddish, or brown hue, it is crucial not to dismiss it. This condition, known medically as hematuria, can be an indicator of advanced prostate cancer. There are times when the blood is only visible when examined under a microscope. While it's true that other issues like urinary tract infections or kidney stones can cause this, any man over 40 and especially over 50 should not hesitate to see a doctor. The sooner a problem is identified, the greater the likelihood of a successful treatment. Moving on to sign number 11, difficulty with urination or the persistent feeling that your bladder isn't empty. Do you ever find yourself at the toilet straining to urinate only for the stream to be weak, or do you walk away still feeling like you need to go? This can happen when a tumor on the prostate begins to press against the urethra, which is the tube that expels urine from the body. What starts as a minor inconvenience can, over time, become a serious warning sign. Sign number 10 is an inability to urinate in a standing position. While it might seem peculiar, some of my patients report that they are only able to urinate when they are sitting down. The reason for this is that a prostate that is enlarged or affected by a tumor can obstruct nearly all urine flow. If you notice a sudden shift in your body's urination patterns, you should view it as a red flag, not just a strange coincidence. Sign number 9 is a burning sensation during urination or ejaculation. It's easy to assume this is just a minor infection, but when a tumor is causing irritation or inflammation in the tissues surrounding the urethra, that burning feeling will not resolve until the underlying issue is addressed. A lot of men tend to ignore this, hoping it will simply go away on its own after a few days. Unfortunately, that delay can sometimes have devastating consequences. Sign number 8 is frequent urination during the night. Waking up once or twice a night might be considered normal with age, but if you're getting up 3 or 4 times, it severely disrupts your sleep and can leave you feeling depleted throughout the day. This could be a sign that your prostate is enlarged or that a tumor is exerting pressure on it. It's sometimes referred to as the silent sleep killer because of how it gradually erodes your overall health. Sign number 7 is unexplained weight loss. If you find that the pounds are dropping off without any changes to your diet or an increase in your exercise routine, you need to be cautious. Advanced prostate cancer can alter your body's metabolism and how it consumes energy, leading to weight loss even when your eating habits haven't changed. You shouldn't just assume you're getting healthier. Sometimes it's a sign that your body is battling something much more severe. Sign number 6 is bone pain, particularly located in the lower back, hips, or ribs. This is a type of pain that isn't related to an injury and doesn't get better with rest. When prostate cancer metastasizes or spreads, the bones are frequently the first place it goes. If you're experiencing a persistent pain that is spreading and intensifying, you need to have it investigated before it's too late. Sign number 5 is persistent fatigue. This isn't the kind of tiredness you feel after a long, busy day. It's a profound and relentless exhaustion that doesn't go away, even with plenty of rest. This can occur when your body is in a constant state of fighting cancer or when a tumor begins to interfere with blood production. It's often mistaken as a normal part of aging, but if it lingers for weeks, it should be considered a major red flag. Sign number 4 is blood in the semen. Discovering blood in your semen can be and should be an alarming event. It can be a result of blood vessels in the prostate being damaged by a growing tumor. Even if it occurs only once and then disappears, if it ever returns, you must treat it as a serious signal to get a medical evaluation. Sign number 3 is weakness, numbness, or a tingling sensation in the legs or feet. This may not seem directly related to the prostate, but if the cancer spreads to the spine, it can compress the spinal nerves. This pressure can lead to weakness, numbness, or a pins and needles feeling in your lower extremities. In advanced cases, it can impact your ability to walk and even your control over your bladder and bowels. Sign number 2 is a pain in the pelvic region, lower back, or upper thighs. This is often described as a deep, dull ache that gradually spreads over a period of time. Spreading cancer cells and tumors can lead to inflammation, swelling, and pressure on the nerves. Unlike the typical joint pain associated with getting older, this discomfort will not respond to standard painkillers. And finally, sign number 1 is erectile dysfunction. If you have never had issues in this area before, but suddenly find yourself struggling to achieve or maintain an erection, it could be an important warning sign. Prostate cancer itself, or the treatments for it like surgery and radiation, can inflict damage on the nerves and blood vessels essential for sexual function. It's crucial not to dismiss this as just a part of aging. It could be your body's way of telling you that you need to get checked. So, what are the causes and risk factors? Prostate cancer develops from changes in the DNA of prostate cells, causing them to multiply out of control. Some of these risks are genetic. If your father or a brother had prostate cancer, your own risk is doubled. Other factors that elevate your risk include a diet heavy in red meat and high fat dairy, smoking, alcohol consumption, and a sedentary lifestyle. Additionally, African American men face a statistically higher risk than other ethnic groups. While there is no foolproof method for preventing prostate cancer, you can certainly lower your risk. This involves maintaining a healthy weight, incorporating more vegetables, omega-3 rich fish, and lycopene rich foods like tomatoes into your diet, and aiming for at least 150 minutes of exercise per week. Most importantly, it means getting regular screenings after the age of 50, or even earlier if there is a family history of the disease. You are now aware of the 12 early warning signs of prostate cancer, subtle signals that can represent the difference between maintaining your health and losing the window for effective treatment. It is vital to remember that this disease can affect anyone. It advances quietly, and if it is discovered too late, the available treatment options become significantly more challenging. For this reason, do not wait until the symptoms become undeniable. Pay attention to your body, schedule regular checkups, and begin implementing positive lifestyle changes today. You've heard the heartbreaking statistics mentioned in this video, but you do not have to become one of them if you take proactive steps now. If the information shared today has made you realize something important, I urge you to pass this video along to your friends and family, particularly the men in your life over 40. A single share could truly save a life. And if you're interested in learning about the everyday habits that could be silently harming your prostate, click the video now appearing on your screen. What you learn might surprise you and could completely transform how you approach your personal health.